Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, I am honored to welcome a remarkable person and friend, Kian Saneii. He is the founder and CEO of Independa. Welcome, Kian. How are you?
It's great to be with you today. I'm doing well. Thank you.
It's a pleasure. You know, I introduced you as the founder and CEO of Independa. Why don't we first start off with, for people that may not be familiar with it, what is Independa?
Independa from the get-go was designed and developed to be a remote engagement, education, and care platform focused on the elderly. We worked early on with IDEO, the design firm, in answering the question, how come technology hasn't really done a great job for that particular demographic, and what needs to be done for that to change? So that was the premise of how Independa was founded. Credit to them, and really was all about two things: about best engagement platform possible and the simplicity that has to rule every action, every service, every benefit. So engagement and simplicity, that's what we do.
Is that how you would say the idea came about, is just trying to address the shortcomings of technology in the senior care space, or was there something else that was a catalyst?
The catalyst was I had a family member, my grandmother, who my parents were taking care of, and there was really no technology for them to use. And being a tech person myself, I looked around and found there was really the brand for tech for older adults was still iPhone and I can't get up, which is like from 40 years ago now.
Right.
And after that was the clapper, if you remember, clap on, clap off.
Oh, yeah.
So I was wondering, why haven't we succeeded in this really important market? Because we don't have enough tax dollars, we don't have enough caregivers, we don't have enough beds, and we need to be better at engaging folks when we can't be with them in person. So that's how the idea came about.
Okay, yeah. And usually I always find, at least in my situation as well, the best ideas seem to come from a personal experience, So people that are listening to this, watching this now or, years into the future, they're going to hear of other companies, right? Because everybody's trying to get into the tech space, everybody's trying to get into the senior care space. But what really makes Independa different from those other similar solutions?
Sure. So from the get-go, everyone can talk about, being simple. It takes a lot of energy. As Steve Jobs said, it's very hard to be simple. It's very complicated to be simple. So that's really just part of the effort, which may be behind the scenes as an average person, you may not know that. But the two or three big things are that we went on to the TV very early on, and to this day, we're unique in how we are on TVs. So we're in every LG consumer TV, in every Sony TV. We worked with LG for over 10 years now, where we've embedded ourselves in the commercial TVs, but also now in consumer TVs for multiple years, since 2022. And one of the unique things is that you can have Independa downloaded from the LG store, and you can interrupt any program, anything that you're doing on any input. So you can be playing a video game, you can be watching Netflix, you can watch satellite, whatever. You can still get a doctor request or a medication reminder, or your daughter calling in with our companion app to do a video chat with you, or send you a picture, or send you a little video clip from Joey scoring a soccer goal. So all those things can happen on your TV without you learning anything new. So that's huge. That's very different. The other thing is that we can be on any platform. So TV, computer, tablet, even phones. And then there's a companion app that's on iOS and Android for your friends and family, as well as professionals that can connect with you. But the biggest thing, Lance, is really all about engagement, as I mentioned. And we engage you in 4 different ways. So we engage you for social engagement, including embedded life stories, so you can capture someone's wisdom and memories. We engage you operationally so you can have efficiency and effectiveness as a senior living group or as a home care organization, as a short-term rehab group, even in hospitals, so you can have efficiency for staff and the organization. Multiple integrated applications. We engage you clinically. So we integrate with devices. That's again very unique from our perspective, where you can have essentially a remote patient monitoring with either digital access or analog. You can enter things, you can even speak your measurements into our system, and you have thresholds and alerts. So you can catch little things before they become big problems. And then last engagement is services engagement, where you can have a hearing assessment. You can talk to a doctor 24/7, a dentist 24/7, a therapist 24/7. You have access to WebMD medical grade content for health education. You have access to exercise videos, educational videos, games. So when you combine all of this, social, services, organizational, and operational engagement, it's really all about how do you make someone's life easier so they can live where they are longer, safer, more comfortably, wherever in the spectrum of care they are. So that, gave you, I hope, 3 or 4 different ways that we're
Incredible.
unique.
Yeah. I mean, I always research and try to learn as much as I can about our guests and their companies before they come on, but I was not familiar with some of that. And I'm in awe because those are, like you said earlier, those are simple things, but they're difficult to get there. And I just think those are incredible, Kian. And, so really at the end of the day, what do you say, Independa is all about?
It's really all about taking care of our constituents, and we have a few constituents. The most important constituent for us is what we generically call our caregivers.
Mm,
So that could be a member, that could be a patient, that could be a client, that could be a participant, depending on the industry and across the continuum of care. So they have to want to be engaged, have some benefits to be in the system, and it's not about being old and it's not patronizing. It's about really being connected. So that's the most important thing. And then our customers who are operational benefits for them come into play. Things like staff efficiency. Imagine in a senior living environment, you have menus, you have community calendars, you have work orders, you have broadcast messages, digital signage, surveys, all connected. So you have a platform for engagement. You have a platform for billing in the back end.
right.
You might have a platform for, dining, but you don't have all of them come to one person in a unified way so that all those become much more efficient. So that's the second constituent is our partners and our customers. And then last but not least is the circle of care around the individual. So the friends and the family and the neighbors and the daughters and all of that. How do we help you be a part of this so that if instead of calling in, let's say on a weekend and say, "How's mom doing?" You could look and you can call in mom directly, or you could see through non-repudiated journal notes whatever happened during the week. So when a caregiver is talking to mom, she takes a picture and they smile, and you get to see that right on your mobile app. So, and if there's an issue, they could leave a message. So all of that combined really, Lance, is the 3 big ways that we live up to the brand, which is taking care of our end user care recipients, taking care of our customers who are taking care of those folks, and then taking care of the family members who have peace of mind. And really also part of it is lack of guilt of am I doing enough when I can't be there? So we really help with both of that on 2 flip sides of the same coin, peace
Right.
of mind and guilt.
Yeah, and guilt's a big one. It is a big one. We see a lot of our family members, they feel guilty that they can't be there all the time, but realistically, they can't be. So they do the next best thing. They would hire our company, or they get a tool like Independa to help with that. So that's incredible. One of the things that I enjoy the most about what I do with our company, not necessarily the podcast, Kian, is getting to spend time with these families, getting to hear their stories. I have a plethora of, moments and memories that will always stand out to me just because it kind of reinforces that we're making a difference. So I'm sure you have some with Independa. What's some of the most touching moments or memories that you have from your customers?
It's really all about that on a personal note, Lance, that before Independa, I've always been in software, always been in technology. And I'm always excited about whatever I was doing. But when you have that human element, instead of, let's say, object-oriented programming or document management or security on the internet and all those things which I've done in the past, when you get a text from a daughter who says, "My mom passed away over the weekend," and this was literally a Saturday text, and she said, "I want to thank you for what you and Independent have done for our family." And I was just so touched for her to think of us to send that. And then she said, we were leaving the funeral home, and the first thing my dad said was, "Can I keep the Independent TV?"
Mm.
And I mean, what do you say to that? And of course, and the reason was that the pictures that were being shared, he wanted to show those pictures to everyone. And nowadays, nobody prints pictures, right? So if you're older and you don't want to see little tiny images on a phone, you can actually present them on the TV. So dad would have friends over and they could actually enjoy all the pictures that were on the TV. So that's probably the best one. There's many others, but yeah, that I will never forget.
That's amazing. That's amazing. You know, I'm a boss like you're a boss, and there's always difficult choices and things that have to be done. And, I want to kind of talk to you about what's some of the most difficult things you've had to do as a CEO.
Um, well, I kind of, it's an interesting title. I kind of look at myself as working for everyone. I'm
Yeah,
sure you do too.
yes.
Um, which is the right way. But I would say the most difficult thing was a moment in time when we were doing a major rollout, and this was like right around when COVID was hitting, and the rollout had to be stopped. And there was a huge financial ramification for us, and we were ramping up as a company to do super well for our customers, which is, our privilege to do that. But suddenly, if everything stopped, we didn't need the people
Mm.
that we had to ramp up, and and also there really wasn't any light at the end of the tunnel that I could see at that moment of what is this thing, COVID? When is it going to end? How are we going to get back into seeing people, get back into their rooms and so forth? So all of that was on a Friday afternoon, and I walked over to my CFO's office right next door, and I said, I just got this email, and we have to do a reduction in force, like a major, major reduction in force right away. And I don't know if this is the case in every state, but in California, you have to wait 3 days between notice and actually when somebody leaves the position. So you can't even do it right then. And on Tuesday, I was able to sit down with many, many folks in our company one on one and explain the situation. And it was something I won't forget, but also it was a beautiful moment because so many of the folks not only understood and were supportive and were concerned really about me and the company, but in some cases people worked for free. Not, and I can't say that because that seems like probably I'm breaking a labor law, but people like chose to, like, when they weren't getting paid, to still do something or help some way or be a part of it. And so I will never forget that. And that moment was at the same time the most difficult and probably the most beautiful going
Yeah.
forward.
No, it sounds like it can, and I'm sure also another thing that I'm going to put words in your mouth, but I'm sure there was a respect for you to have the decency to sit down with them one on one rather than just send out an email or what have you. Yeah.
Like we've seen on some social
Yes.
media.
Yes.
No,
Absolutely.
no,
Absolutely.
no. It was like having to cut pieces of yourself.
Yeah.
So yeah, it
Yeah.
wasn't easy on anyone. But here we are, and it was necessary. And here we are, and many years later, and we're really growing in interesting, nice ways, and in new markets as well. So it worked out, but also the humanity of some folks and the friendship of some folks really came out.
That's incredible. That's incredible. You have a tagline, and it's important. I'm going to emphasize the grammar on it. It's life, comma, connected, not just life connected. Can you tell us what that really means?
Yeah, it's that engagement part and the simplicity of engaging. Really, it's all about connections. It's all about engagement. Um, It's if we would have said life engaged, it might have been like a marriage thing. But connected, I think people understand generally, and it's all about how do staff connect with people? How do organizations connect with people? How does your daughter connect with you? How do you connect with the outside world? And we're so privileged. I don't think any of us really, for probably maybe our entire lives, are alone, at a great amount of time.
Right.
But there's many people in our country and elsewhere where you might have weeks on end, you don't have human contact. You might be one of two or three siblings or a single child, and folks around you may have passed, your friends have passed, your parents have certainly passed, and you may not have children, and children may be away. And suddenly you either had a spouse and passed, and suddenly you could be spending weeks on end in your home.
Right.
Um, I don't know if I have time. I think it's a good story to share,
Yeah,
maybe to
please.
bring us home. I was talking with a executive at one of the infusion, not infusion pumps, the oxygen tank companies for COPD, and they were a leader, and somebody internally came up with a great way to save money and not intrude on people's lives, and change these tanks like a little bit longer at a time. So if it was 2 weeks, let's say they were changing it to 3 weeks at a time. And of course, that was great economically for the company, and they were going to interrupt you less and so forth. And they ended up starting to lose customers. And they looked into it and they realized the customers that were switching, they were the only human contact with them.
Wow. Yeah.
And literally, like, Mary Beth gets dolled up and she makes tea and has cookies ready because this particular Tuesday is when the truck comes and they switch her oxygen tank. And she's engaging with that person in that moment, as brief as it is.
Yeah.
And when you think about what that implies and how can we connect with that person. So life connected is all about that. It's all about that example is if we can bring her life into the world and the world into her life with connectivity, simplicity, engagement, and care, then that's a good day for us.
Yeah, and it's so true. So many seniors in this country live in isolation, and that is the very minimal little contact that they do get. We see that with the families that we help. Sometimes they only need our help once a week, but that one day a week means everything to that person because that's going to be their only social engagement and interaction with somebody. It's very sad. With Independa, you guys, you're well known here nationally, but are there international opportunities for Independa?
Yes. So really, what has happened is healthcare has come into the home over these years. And when we started, we were intentionally just outside of the medical environment. And what's happened is the medical environment has kind of come into the home environment and blended with home and health.
Mm.
And so in that context, there's countries and regions that are looking at how do I engage my citizens more effectively? How do I have maybe a platform? And by the way, delivered by my TV would be ideal. But also you can have cellular companies, basically somebody who has access to the consumer. And in that environment, I can tell you, for instance, there's countries in the Middle East that are looking at keeping people away from the hospital, even though they spend a lot of money on hospital infrastructure. But home care becomes much more strategic. Engagement from in the home becomes strategic, and at a national level, being able to have a platform that does that. Same thing in Latin America, where you might have a cable company that also has a partnership with the hospital. And now suddenly our platform works on both sides, where you're talking about engagement in the hospital, but the hospital sends a person home. You're talking about engagement in that home through the cable company. And it all reduces costs, improves quality of life, reduces anguish. That's what it's all about at a national level. So there's a number of opportunities that way.
Yeah, that's incredible. And, I'm going to ask you this next question, and this is a loaded one, so I hope you're ready for it. What do you think of the state of the healthcare in our country right now?
Well, I think anyone who has any engagement or pays any kind of insurance knows that we're not in great shape in that model. I mean, just statistically, We have gone from 15% of our healthcare costs being big pharma to now 50%. 76 and rising percent of our costs are taking care of chronic conditions, which you would think, we could do certain things to minimize that and reduce that at least. But that hasn't happened. That keeps going up. Um, a big percentage of our healthcare costs, I think it's a little bit over 25% right now, is going to insurance companies. So when you think about the history of insurance companies, they really all came out of World War II and helping with the paperwork for companies that were offering this benefit as low cost insurance, and we've gone into this area. We have something like 80 million that are underinsured or uninsured, and we have 20% roughly of our GDP getting to $4 trillion of healthcare costs a year. And when you think about where we stand in the world, let alone industrial countries, we're not first, we're not second, we're last in
Right.
almost every measure. So just very objectively looking at, how are we doing in healthcare? But then you get into the human aspect of it. You get into the fact that we have so many bankruptcies, not for the underinsured or uninsured, even for the insured. We have so many situations where your copay basically puts you out of business in every way. You have to sell your home. So we have to address that as a country, and it's very challenging. But I do believe that health care and health is a right, and you have a right as a citizen of a country for that country to take care of you if something goes off. And as a society, we all pay into a pool to support those in need.
Yeah.
But somewhere in the middle, that doesn't meet, and then people have to pay more or not pay and be at risk and show up for ER, and then everybody else pays for that, except there's no prevention in that model.
Right. No, absolutely. You
But
know,
other than that, I have no thoughts on it.
okay. Yeah. That's a whole nother topic, right? Whole nother episode. I want to ask you though, before I go to this next question, Independa is a very social prescribing like resource for healthcare. And, we talk to a lot of people that have different, resources, whether it's, music engagement, arts, and all these other social activities. Do you ever see us getting to a point where social prescribing will be covered under healthcare?
Um, we're almost there in certain ways. Like
Mhm.
there's this concept, I'm sure you've heard, social determinants of health, so SDOH. And what social engagement has shown, and the flip side of that is what lack of engagement has shown. In other words, I'm lonely, I'm isolated, and then that leads to depression. That has been shown to clinically lead to self-neglect, clinically lead to medication neglect, and clinically lead to recidivism into the system for anguish and cost for me and the system and my family. So there is, financial gain to help people socially stay engaged and stay connected with a life that's connected.
Right.
I don't know if there's a clear path that I see right now in our country where somebody says, you know what, if you get a system like Independa, we'll pay for it because clearly there's social engagement versus, we'll pay for medication or we'll pay for a doctor visit. That said, in other countries, like in Australia, and this was part of an act in Congress. We had the Class Act and the Class Bill that ultimately didn't make it through. But there's something to be said about we have roughly 50 million people that are being taken care of by someone else. So you think about that, that someone else is another 50 million. So we have 100 million Americans minimum that want to stay independent and have at least one person in their family trying to help them stay independent. If you look at that model and say the cost of helping them stay healthy is minor compared to the cost of doing nothing,
Yeah.
and then they show up with early on stage of whatever that is. It's the chronic condition, or it's an ER visit, or it's a fall, or it's isolation that leads to medication. If you can somehow take care of them better, which is what our system would do, and a lot of that is around home care, for
Right.
instance. So, like in Australia, they say, I forget what the number is now, but it used to be 6,000 Australian dollars a year to a family member who is a designated caregiver. Choose to use it however way you want for the benefit of your mom.
Yeah.
You know what's best. If you want to install an electric chair that goes up to the second floor, so she can come and go more effectively, great. If you want to hire home care with that funds, do that. If you want to bring in Independa so you and the family and the neighbors can be connected from a distance and help mom stay independent, do that. If you want to get a pill box, do that. So I think that's where I would see some minor investments upfront that allow us and other type of non-medical solutions to help the person stay where they are, more independently for a longer time.
No, I couldn't agree more. The argument you just made for, social prescribing, we make the same argument for home care. If you have that person there monitoring that they're getting their meds taken, they're doing their follow-up appointments, their PT exercises, you're reducing that readmission rate. And, but hopefully we'll see that come to fruition one day. You shared some stats with us. Are there any other stats that you think will not just inform us, but maybe even shock us and drive us into some level of action?
Yeah, and off the top of my head, the one that just came to mind, we do an annual older adult survey,
Hmm.
and it's amazing, Lance. Every time I learn something new from our own survey.
Yeah.
And last time it was really a shocking statistic where 93% of the respondents, 55 and over, said that they do some or a lot of compromises in their health
Hmm.
in order to be able to pay for food and vice versa. So for them, it was a choice of either I eat or I buy my medications. That's what it came down to. And so that was I knew the number was high, but to be that high.
Yeah.
And the one that the number the higher number or the worst condition, I think we called it significant compromise, something like that. That wasn't a small number. Like I'm not bundling somewhat being like 85%, the other one being 7. It was like 36% was significant compromise, and then like 60% was somewhat compromised. Their financial well-being in order to do their health.
Wow. It's just it's shocking, sadly, but until action gets taken, I don't see that number changing. If anything, it's probably going to get worse with the cost of living continuing to increase and prescription drug costs going up. And yeah, I mean, hopefully we can all do our part. But on a more positive note, for our viewers and listeners, I know we had mentioned before the podcast, you're going to do something special for them. What is that?
Well, I think if anyone wants to leverage our system and use our system, we're happy to provide a discount. If you go to independa.com, you could basically sign up for free for the services, and then you pay as you go. But I can have I want it to be very personal. So let's just say the first how many would you like? The first how many? 10, 100?
Whatever you want, Kian. It's very generous. Whatever you think's a good number.
The first 50 people who reach out and let us know, we'll do some special things, some lifetime special considerations for them.
Wonderful.
So they
Thank
can
you.
reach me directly at my first initial last name at independa.com. And I'm happy to then chat with you. If we can be of help to you or your family, then that's what we do. That's what we live
Thank you. Thank you. And just to clarify, we'll have the links all in the show notes. We'll put your personal email in the show notes, which is very generous. And I just want to clarify because we get a lot of international listeners, and viewers, Canada, Australia, UK, Europe. Are they all able to take advantage of that?
Not at the consumer level. So
Okay.
if there's a home care organization that's looking to bring it in for themselves,
Okay.
or if there's a senior living group, or if there's a hospital, or if there's an entity like our partners at Dish, for instance, if you have a cable operator that hears this, then we can work with them and absolutely do that. Happy
Perfect. Before we close, I want to just ask a fun question. What do you do for fun? Because I know how busy you are. I know how busy I am. I don't have much voice today because been soccer all week. But what does Kian do for fun and to relax?
Well, I don't know about relaxing. I get my energy not out, but I actually, in a way, get it in. I, like you, do soccer. So I was actually at a soccer game at 6:30 this morning.
Wow.
And
Okay.
so I play till around 8-ish and then get back home in time for a shower and I'm ready to go at 8:30. So yeah, I played like 3 or 4 times, which is crazy. I know like people who know it should say, don't stop a week when I can. So that gives me all the energy. And then other stuff is just family time and sometimes bicycling if I don't play soccer, but otherwise work, and it's really not work for me. It's a joy.
And I'm glad you said that because I feel the same way. So, Kian, CEO, founder of Independa, thank you so much. I just want to say, I've come to really admire and respect you, getting, a few conversations we've had leading up to today. And I sincerely mean this. I think we need more people behind these companies with the motivation and drive and passion that you have to truly make a difference and truly help, because it's not just a business for you. You're trying to make a positive difference in people's lives, which we know Independa is doing. So, thank you for that on behalf of all of us here.
I appreciate that. That's very nice of you to say.
Absolutely. And we look forward to working with you and helping you in the future.
Likewise. Thanks so much. Great
Our
chatting.
pleasure. Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Kian for joining us today. We look forward to seeing you again here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.